Scabies is the topic, and scabies is essentially a skin infestation by a mite, and that mite has a special name, and the special name of that mite is Sarcoptes scabii. And this mite is essentially a parasite that infects human. In particular, it infects the skin. And what it does is it lives inside the epidermis, and it creates these burrows that it can habitate inside, burrows or tunnels. And we'll talk a little bit more about that. I'll show you a picture of those burrows as well. The method of transmission is person to person, and this happens most commonly in crowded places such as schools or homeless shelters, places like that. Now, what are some of the symptoms involved? Well, before I show you a picture, I just wanted to illustrate that by far the most common symptom is this intense pruritus, intense itching. And the actual rash is just red papules, erythematous papules. But fortunately, because many rashes have erythematous papules, it's hard to differentiate. But fortunately, with scabies, there's ways of differentiating. So here's a picture of scabies, and right here I wanted to show you a burrow. Now, the burrow essentially, you can't really see it that well, but if I were to exaggerate it, they're like these lines like that. And essentially what a burrow is a track-like tunnel, and this is pathognomic for scabies. And of course it's in the skin, in the epidermis, and it's fine, raised lines, and there's a papule at the end, and there'll be a line like that. And then the important thing to remember is that the mite actually lives inside. It creates this tunnel under the skin, and that's where the mite is laying their eggs. So that's a very important aspect of the differentiation of scabies to other rashes that have erythematous papules. And another thing that can help you distinguish scabies is where the rash actually occurs. Some of the more classic places are the finger web spaces. So for example, if you had a hand, the finger web spaces are these areas right here. Other common places that scabies can be found if infected are the flexor surfaces of the wrist and elbows, and also axillary folds, the belt line, and the lower buttocks, and also the genitalia can be affected as well. So these are some of the locations that you can see those papules. So how do you diagnose this? Well, other than the history and the appearance of the rash, what you do is you take one of these burrows. So this is the burrow and this is the papule, and you place mineral oil over the burrow. And then what you do is you take a scalpel and you unroof this burrow. And then what you do is you take the scraped material that lies underneath and you place it on a slide. And that will be able to help you identify the mite under a microscope. The treatment of scabies involves very popular lotions, topical. One is permethrin and the other one is lindane. Now this one is used a little bit more commonly. These are topical treatments. They're creams, lotions. And two very important things also involved in the treatment is that you must treat the contacts. All the people that were involved in terms of being in close proximity to the patient who's been affected. And then another important point is that all the clothes and bedding must be washed thoroughly in boiling hot water. And that's done in an attempt to, of course, kill the mites. So let's take a look at some vignettes. 18-year-old college student comes to the clinic because of an extremely itchy rash on her hands, abdomen, and legs. She says that she was home for spring break a couple of weeks earlier and her younger brother had a similar rash. She says that she first noticed the symptoms after taking a nice hot shower when she returned to her dormitory after vacation. She says she is having trouble sleeping because of the pruritus is most severe at night. Physical exam shows papules, vesicles, and plaques symmetrically distributed on her wrists, underneath her breasts, around the navel, her buttocks, and inner thighs. There are dark wavy lines that end in a pearly bleb in between her fingers. The most appropriate next step is, well, classic symptoms for scabies and classic locations for the rash, and I like how they mention these lines, which are of course those burrows. So most appropriate next step is place a drop of mineral oil on a bleb and unroof it with a needle or scalpel, then examine the scrapings under a microscope. Well, that's absolutely correct to how to diagnose scabies. So that needs to be done. That as the most appropriate next step in order to make the diagnosis. And finally, you care for a family that consists of a 38-year-old husband, 36-year-old wife, 6-year-old daughter. Daughter is brought into the office because of itchy skin that is particularly intense at night. Examination shows gray, tortuous, thread-like lines in the interdigital folds and 3 mm reddish-brown nodules on the groin and axilla. Mineral oil is placed on the lesions, and scrapings from the lesions are examined under a microscope. Adult mites are seen. Examination of the other members of the family is unremarkable. The most appropriate next step in management is, well, again, the classic description of burrows, and then they've already done the diagnostic test, and they've concluded pretty much that it's scabies. So they're basically saying, how do you treat it? Advise them all to wash bedding in warm water. No, because it has to be boiling hot water. Exclude the daughter for school for 1 week. Well, that doesn't really treat anything. Biopsy of one of the reddish-brown nodules. No, biopsy is not really part of the diagnostic process of scabies. So the last one, prescribe permethrin lotion for all family members if they are not allergic to the medication. Well, that's the correct choice. So all family members includes the daughter and her parents because they are obviously close contacts.